Welcome back, everyone, to the High Impact Medicine podcast. I'm your host, Kujani, a medical student from Cambridge, UK. High Impact Medicine is a community of doctors and medical students hoping to lead impactful and meaningful careers. This podcast chats to medical doctors pursuing diverse career paths, ranging from public health, entrepreneurship, humanitarian medicine, and so much more. As medical students, we often want to know how to do the most good, but it's not always clear where to start. So I hope these discussions will leave you informed and inspired. Today's guest is Dr. Michael Greger, who is a physician and internationally recognized speaker on nutrition. His science-based nonprofit, nutritionfacts.org, offers a free online portal hosting more than 2,000 videos and articles on a myriad of health topics. Dr. Greger is a sought-after lecturer and has presented at the Conference on World Affairs and the World Bank. He is a graduate of Cornell University of Agriculture and Tufts University of Medicine. He is also an acclaimed author with more than 1 million copies of How Not to Die, which have been sold. I'm really excited for our conversation today. Dr. Michael Greger, welcome to the podcast.
So happy to be here. I remember being in your shoes and wondering what to do with my life, and I hope I can help a little bit in guiding people to figure out what's right for them.
What is your earliest memory of healthcare or medicine?
Well, my mom was a nurse, and so medicine was always really kind of part of the family, and so I just kind of grew up with that kind of constantly being in the background.
Okay. And were there any pivotal moments in your life that encouraged you to pursue a medical career?
Well, it all really started with my grandmother, actually. I was just a kid when the doctor sent my grandma home in a wheelchair to die. She was diagnosed with end-stage heart disease. She already had so many bypass operations, basically surgery. Surgeons kind of run out of plumbing at some point. Confined to a wheelchair, crushing chest pain, her life was over at age 65. But then she heard about this guy, Nathan Pritikin, one of our early lifestyle medicine pioneers, and what happened next is actually detailed in Pritikin's biography. It talks about Frances Greger, my grandma. They wheeled her in, and she walked out. So she was given a medical death sentence at age 65. She went, thanks to a healthy diet, was able to enjoy another 31 years on this planet until age 96 to continue to enjoy her 6 grandkids, including me. So that's why I went into medicine, why I practiced lifestyle medicine, why I started the website, the nonprofit nutritionfacts.org, why I wrote the book How Not to Die, why 100% of all the proceeds I get from all my books are donated directly to charity. I just wanted to do for everyone's family what Pritikin did for my family.
Wow, thank you for sharing that story. So your grandma really was the why behind everything you do and continues to be that. So once you joined medical school and thinking to where you are today, how do you think you kind of got to where you are? What sort of factors led to you pursuing a lifestyle medical career in medical school? Was this something you already knew even before you started?
Well, it wasn't until summer 1990 when Dr. Dean Ornish published his Lifestyle Heart Trial, which is the first randomized controlled trial proving that you can reverse the progression of heart disease, the #1 killer both in the UK and here in the US, with this plant-based diet and lifestyle program, the same kind of program that reversed my grandmother's heart disease. And when I was a kid, it never really struck me as anything strange had happened, right? My grandma was sick, went to the doctor, got better. Like, that's what's supposed to happen when you go to the doctor. But what I didn't realize is how revolutionary what had happened to her did. Back then, we didn't think heart disease was reversible at all. We thought you just got worse, and then you die. Pritikin had been reversing heart disease by the thousands, but this was before we had imaging techniques such as quantitative angiography, where we could actually see what was going on inside people's arteries. So when someone went to Pritikin, with crushing chest pain, And then all of a sudden chest pain goes away. The doctor be like, well, you didn't reverse heart disease. Heart disease can't be reversed. Obviously what happened is they never had heart disease in the first place. And so it wasn't until Ornish came along and could actually show with angiography that, you are actually opening up arteries without drugs, without surgery, just this plant-based diet and lifestyle program, and then later showed all sorts of, it can clear up perfusion defects, and used all sorts of really fancy technology to validate this really low-tech, low-cost solution, which was just improving one's diet and lifestyle. And so, that really had a huge impact on me. Yet, it was like, crickets, right? It was published in The Lancet, perhaps the most prestigious medical journal in the world. And, and so here we are, we have the cure right, for the number one killer of men and women. Yet here we are decades later, over 30 years later, and hundreds of thousands of people here in the States and around the world continue to die from this preventable, arrestable, potentially reversible condition. And so that really struck me. Like, why, if we really cared about saving lives, if that's what we purport to be the reason, that's what we give at the medical school interview, we want to help people. If that's really the case, then why aren't we focusing on what's really killing people, which is diet and lifestyle choices? About 80% of what comes into primary care these days are these chronic lifestyle conditions like type 2 diabetes and high blood pressure and heart disease and obesity, etc. And so shouldn't 80% of medical training be about teaching people clinical nutrition? To be, according to the Global Burden of Disease Study, the largest study of risk factors for death and disease in human history, funded by the Bill and Melinda Gates Foundation, the number one cause of death in these United States and for humanity in general is the Western diet. And so it's the number one cause of death and disability. Well, then surely the number one thing we're taught in medical school is nutrition, right? It's the number one thing your doctor talks to you about at every single appointment, right? So wait a second, how can there be this disconnect between the science and the mainstream practice of medicine? And that really started me on the path to devote myself to the practice and study of lifestyle medicine, using lifestyle interventions such as diet and exercise, not just to prevent chronic disease, that's preventive medicine, but to actually use it to treat it and potentially reverse it as well.
You spoke there about the disconnects. I wonder whether, as you were doing your medical degree, did you feel like the focus on treatment, on special investigations and procedures, did you feel a disconnect there between the emphasis placed on those more interventions that we might do on patients compared to the more lifestyle style interventions that we may offer? Like, how did you find going through a degree and feeling like there perhaps wasn't enough emphasis?
So I was lucky enough to do good on standardized tests such that I can choose whatever kind of medical school I wanted to go to. And so I chose the single school with the greatest number of hours in nutrition training. And so that was at Tufts Medical, just because they have an adjoined, in the same building, they have the School of Nutrition there. But yet it was still only 19 hours. So 19 hours out of the thousands of hours of preclinical instruction was nutrition. Of course, it wasn't clinical nutrition, right? It was the Krebs cycle all over again. It was the biochemistry of vitamins. No, what we need is actually the use of nutrition to prevent and treat disease, which we really weren't getting. So that was disappointing. And so, doctors suffer the severe nutrition deficiency in education. Most doctors just aren't taught about the impact healthy nutrition can have on the course of illness. And so we graduate without this powerful tool on a medical toolbox. Now there's also institutional barriers, right? Time constraints. Here in the States, lack of reimbursement. Here people aren't paid for counseling people on how to take better care of themselves. And of course, drug companies play a role too, influencing medical education and practice. You can ask your doctor when's the last time they were taken out to dinner by Big Broccoli. It's probably been a while. It's like basically, I realize it's kind of like smoking in the 50s. There were already, by the 50s, decades of science linking smoking and lung cancer. but it was ignored. Why? Because smoking was normal. Most doctors smoked. The average per capita cigarette consumption here in the States was 4,000 cigarettes a year, meaning the average person walking around smoked half pack a day, on average. Right? The American Medical Association was reassuring everyone that smoking in moderation was fine. Right? So there was this same disconnect between science and public policy. And it took more than 25 years and 7,000 studies before the first Surgeon General's report against smoking came out here in the 60s. And so until the system changes, we really have to take kind of personal responsibility for our own health, for our patients' health. We can't wait until society catches up to the science again, because it's really a matter of life and death.
Hmm. Yeah, those are some really not necessarily surprising, but very stark statistics there. And it's a reminder of how the time that we live in also changes the public perception of different healthcare norms. You did your medical degree, and now you're really interested in addressing things from the ground up, changing people's lifestyles, enhancing people's health. Did you then pursue a career in clinical medicine, or did you start thinking about public health and enhancing people's nutrition? What did the years after medical school look like for you?
So I decided early on that kind of no matter how many people I saw, so I started out in clinical medicine, but I mean, no matter how many people I could pack into an hour, right? How many hours I worked during the day, I mean, at most I'm affecting the lives of dozens of people, right? And I realized, well, I mean, I could be out there giving lectures and affecting, hundreds of people a day. Or I could, this is back, this is actually in the VHS, this is before DVDs came out. I started making VHS tapes of all my lectures, so then I could send those out. So it was like replicating me, and then it became a DVD series, finally put it all online, and now it can affect the lives of millions of people every day. And so it was just kind of this natural progression of, look, I want people to be healthier. And so I could do that one-on-one, and I miss that kind of interaction. But I'm not doing this for me. I'm doing this to reduce suffering in the world. And so to do that, this life-changing, life-saving information has to get out to the greatest possible audience. The fruit and vegetable industry doesn't exactly have the kind of advertising budget that would enable them to put, ads on the Super Bowl for sweet potatoes or something. So I got to get out there and plug this market failure that the healthiest foods are actually the least profitable foods. Some of the most costliest interventions are not necessarily the most useful or impactful interventions. And so it's just the incentives are kind of misaligned. And so lots of people profit, but unfortunately, people's families' health doesn't profit necessarily as much.
Do you think that more pressure should be put on kind of governments, and whose responsibility is it now to solve these issues in people's lifestyle and health in terms of advertising and kind of public health?
Yeah, this is, I've been working on a series on these GLP-1 agonist drugs like Ozempic. And that is a really kind of clear example of kind of two paths one can go to treat the same disease. So we have this massive obesity epidemic, really pandemic of obesity, eclipsing, as much as a decade off of people's life expectancy, increasing risk of everything from osteoarthritis and diabetes, etc., many types of cancer. Okay, so what we can do? So we have these new class of drugs, which, may cost, well, it's actually a lot cheaper in the UK, but here in the States it's $1,300 a month out of pocket. Of course, in the UK, they're only letting people on it for 2 years. And of course, these are forever drugs. These are if the problem is lifestyle, then if you don't change your lifestyle, right, you have to be on blood pressure medications or blood sugar lowering medications or cholesterol lowering medications every day for the rest of your life. These are the golden gooses of big pharma. But you could imagine how big of an impact that's going to have, and at what cost, versus, treating the underlying causes. And so what's the underlying causes? These changes in the global food system, which has, enabled people to just flood the market with these super profitable, hyper palatable, sugary, fatty, salty foods that, kind of, are designed intentionally to make sure you cannot just eat one. But then, of course, that system will continue, and as more money is kind of goes down the kind of big pharma pipeline, instead of the important public policy guidelines, say, well, what are we going to do? Are we going to do these kind of nanny state measures? How about just like not bombarding our children with thousands of ads for candy and junk food and fast food? And I mean, it's just, there's some really simple low-hanging fruit that we can do to try to decrease the influence of these companies that don't necessarily have our best interests at heart.
So it sounds like you started off with clinical medicine and you soon realized that your impact patient by patient was limited. And that's why you started recording yourself and branching out much, much more broadly. You've also done a lot of work publishing books, and your New York Times bestseller, How Not to Die, has been very popular. Can you tell us a bit about what led you to write this book, and most importantly, what are the key take-home messages for our listeners?
Yeah, it's funny, I didn't want to write the book at all. I was like, wait a second. All my work is available free online, right? Well, why would anyone buy a book? People even read books anymore? Like, the whole thing was just like, I don't understand. But they offered to make a greater and greater donation to my favorite charities. I'm like, all right, finally they reached the dollar amount. I was like, all right, God, I'd lock myself in a prison cell for a year for that kind of donation. So I decided to write the book. So that was How Not to Die, which is just, the first half is 15 chapters, each of the 15 leading causes of death. Talk about the role diet may play in preventing, arresting, or reversing each of our top 15 killers. And then I didn't want it to just kind of be a reference book, though. So that's the second half of the book, which was more practical, day-to-day, grocery store style decisions, where I centered my recommendations around a daily dozen checklist of all the healthiest of healthy foods I encourage people to fit into their daily routine. So, for example, not just, vegetables every day, but particularly dark green leafy vegetables, particularly cruciferous vegetables, not just fruit every day, but specifically berries, the healthiest fruits, tablespoon of ground flaxseed, quarter teaspoon of turmeric, the best beverages, how much exercise to get, etc. Again, trying to just inspire people to include some of these healthiest of healthy habits into their daily routine. It's available as a free app on iPhone and Android, Dr. Greger's Daily Dozen. And so that was the first of my, I think that came in number 4 on the New York Times bestseller list. Since then, I've had 3 other best-selling books. The latest one was How Not to Age, just came out last year, and that was number 2 on the New York Times bestseller list. And collectively, these books have sold a lot of copies in 36 different languages. And so then, again, it's just kind of multiplying my impact. It's the same work. The work is done. It's just, okay, I could do that work in audiobook form, I could do it in ebook form, I could do it in physical book form, I could do it in lecture form, I could do it in, in blog form. And so if you're going to do all, the biggest part of the cost is really just the time and the research. And once the research is done, then it's just a matter of getting it out there in every possible way, however people best digest it. Short little videos, really long books, whatever it is. And so then people can hopefully take this in digestible chunks, no pun intended.
Yeah, congratulations on your books. You mentioned there that you've been offered kind of donations to your favorite charities, and I read that all the proceeds that you receive from your books go towards charities. I'm interested, what charities do you donate to, and how did you go about choosing which charities you donate to?
So I'm a big advocate of effective altruism, this movement of folks trying to figure out how to best use their time and resources on planet Earth to have the greatest impact. And so there's this wonderful organization called 80,000 Hours, whose entire existence is to try to make people make better career decisions should I go into medicine? If I'm going to go into medicine, what kind of medicine should I practice, et cetera, et cetera. And so I encourage people to go to 8,000 hours. And then there are organizations that figure out, that do all the research so we don't have to, as to what are the best charities to donate to, like GiveWell, for example. And so, for example, donating to produce and distribute malaria nets, for example, very cost-effective way to save lives. We can save lives with our checkbooks. We can save lives with our time. There's all sorts of things we can do in life to have this absolutely enormous, oversized impact and help us look at ourselves in the mirror every day in the context of the massive suffering that's going on in this world. We can feel like we're playing a very small part in making it better.
Yeah. So what pays your bills now? Kind of where is your income coming from?
So I get a salary from nutritionfacts.org, the nonprofit. I think I'm the chief science advisor. I don't know what silly title I'm given, but yeah. So then all my speaking honoraria and book sales and everything can all go to charity, and I'm just my kind of day-to-day bills are paid by donors who donate to the charity to put kale on my table.
Amazing. So I saw that you'd been in contact with the Jesse and Julie Rush Foundation to get funding for your website. I was wondering, how do people who have been inspired by your career, how do they go about starting something like this?
Well, I found, to my absolute shock, people are just, so incredibly generous. They're so desperate for this kind of information that so the Jesse and Julie Rush Foundation, they set up the website. Jesse made his fortune in tech. So basically I had all sorts of web developers just put all my stuff online, all the stuff in my DVDs and stuff, just put it online. That's where Nutrition Facts came from. And then he was like, okay, you're all on your own. Like he's like a charity entrepreneur, but then he wants to put his money somewhere else. I'm like, well, what do you mean? I don't know how to run a website. Like, I don't know how to do any of this. You can't just leave me hanging. He's like, no. Put a little orange button on the website, a little donate button. And magically all your financial woes will go away. I was like, wait a second, why would anyone pay if it's like everything's free? Like, what's the. And it's kind of like the Wikipedia model, where, look, everything's free, but people just feel so, it's so helpful for them. They just feel like they want to, contribute. And so we reach so many millions of people that if 1 in 1,000 people kicks in a few bucks, then, we're totally fine. And we can pay all our staff and, and we can continue, thriving and putting out good information. But if you would have told me ahead of time that, like, all you have to do, is just put a little donate button on your website. If you're providing value to the world, people really appreciate it, particularly in these kind of fields where this kind of corrupting commercial influence, where people have a sense these days where they just can't get good, independent, objective information. Like, should I give my kid this new vaccine, or should I? What kind of chemotherapy should I choose, or what kind of whatever? And yeah, the doctor's saying that, but is the doctor saying that because they got money from the company that just gave them all this money, or not? Or maybe they're just doing it because they really feel that it's the right thing, but you can't really tell, and who knows? And, it's just, there's so many conflicts of interest. People are desperate for, like, just tell me what the science says. Like, just tell me the truth. Just, cut through all the BS. And, like, what's the best available balance of evidence say right now about X? Should I take a multivitamin? Like, the most basic little questions. It's like, well, there's an answer, or there's the best answer we have right now, but there's all sorts of people trying to sell you stuff and gizmos and supplements and, and it's just like, well, come on, please. And so when they do find a site where they can really trust and put their faith in, they just are really generous, and they just feel so appreciative that they're willing to keep us going. And we don't even put out at the end of the year we send an email saying, if you'd like to support us in the holiday season. But it's like, other than that, it's just a little button on the site that is just, people can click on or not, and and that's all it took to start this entire thing off. And so I think if there's someone else who has important things to say in the world, and wants to spread that information to other people, it doesn't have to be a subscription model or I will tell you, if you give me money, I'll tell you how to best, help your child's health. Like, that just seems so gross to me. It's like, no, it's like, I don't know, healthcare is a human right. And we can, and particularly knowledge. Oh my God, but this should be everywhere. And so, yeah, I'm excited to get it out there and have been. And so we've never had a problem with, doing what we do. And I think hopefully that'll inspire others to, follow their path. Even if they think, well, wait a second, how am I going to make any money over this? Well, people, if you're doing something that is helping others, people really feel that and will not leave you hanging, at least in my experience.
Definitely. Definitely. And it sounds like you're bridging that gap between the general public and medicine, and more of like empowering patients to take ownership over their health, which in turn gives them the confidence to make the best choices. Um, what do you think is the role of doctors in the media today? Do you think more of us should have an online voice and promote these sorts of lifestyle recommendations? What are your thoughts about this?
Well, I mean, certainly if if you know what you're talking about. It's funny that, there's all these surveys saying, doctors don't talk to the patients about nutrition, right? And you can see that as like a devastating indictment of the medical profession. At the same time, given the state of knowledge among doctors about nutrition, maybe we don't want doctors telling people anything about nutrition, because maybe they're getting their nutrition knowledge from the checkout aisle magazine or something some dude told them at the gym or whatever. And so, like, we don't want them to be flexing the authority they have as a supposed, expert on things that they don't have any training on, right? And so I don't want doctors just speaking up and saying, well, I'm a doctor, so I should be able to say my thoughts on this political hot topic of the week. But look, if that's your background, sure, right? Or if there's something you can offer, but if you really do know something that could help people, then absolutely, I encourage you to not just hold on to it, but to spread it out there. None of us were born with this knowledge, and we just are so privileged to be able to get this knowledge to help others. And there's some things that, only doctors can do. But when it comes to safe, simple, side effect free solutions, such as stopping smoking, starting exercising, eating healthier, you don't need a medical degree to tell people to do this. In fact, that's how I started out right after medical training. Was I went around to lecture at medical schools to kind of train the trainers. Like, I'll tell all the medical students they'll grow up and they'll, tell their patients to eat healthy. And then I realized, wait a second, I can cut out there's no reason I have to wait all that time. I can go to people directly and say, look, there are ways you can take better care of yourself.
Yeah, definitely. And why do you think this is an issue that medical students and doctors should be more aware of and perhaps even start to solve? And what can we do right now as medical students and perhaps doctors early in our career?
So, well, why is it important? Because it is the number one cause of death and disability. If you care about death and disability as a medical professional, well, this is something that should be high on your list. Not only for your health and longevity, but for everybody you touch. People look up to you. We have this unparalleled social authority in society. People listen to us more than just regular people, and so we really should, not take advantage of that, but for kind of exploitative purposes. But we should take advantage of that if there's something that we can actually help people with. To not close off our voices and to get out there and to make the world a better, healthier place.
Great. So use our voice and promote health. One final question. What's next for you in the next 10 years? What's next?
Oh my God. Well, so so my next book is How Not to Hurt on lifestyle approaches to pain management. But immediately in the next couple months, I think I'm gonna do like an Ozempic kind of. There's a 3-hour webinar coming up in a few months, and I'll make that an ebook, audiobook, just because it's such a kind of a game-changing, important a thing to add to the conversation. So that's immediately. But then, yeah, the next book, I'm doing a 10-year update of How Not to Die next year. And then after the pain management book, cancer, I believe, will be next.
Okay, thank you so much, Dr. Michael Greger, for taking the time to talk to me today on the High Impact Medicine podcast. There are lots of takeaways today, both from your career and also some lifestyle tips for us as well. Thank you so much, and I hope you have a lovely rest of your day.
So glad I could help.